Have you ever wondered whether waking up with a morning erection is normal, or how often it should actually be happening? Morning erections, or what doctors call nocturnal penile tumescence, are completely normal and actually a really important part of male health. And believe it or not, they're not just about sexual dreams or random arousal. These spontaneous erections usually occur during a stage of sleep called REM, rapid eye movement sleep, which is when you dream the most. REM sleep tends to happen more often in the early morning hours, which is why many men notice waking up with an erection. But here's the key point: this isn't always about sexual stimulation. It's a natural part of how the body works, and it's deeply tied to your vascular, neurological, and hormonal systems. If you're a teenager, or remember being one, you probably noticed this happening quite a lot. Morning wood was practically a daily occurrence. That's because during puberty, testosterone is at its highest and your body is going through a surge of hormonal and physiological changes. But what happens after the teenage years? Does this morning routine continue into adulthood? And if it changes, should you be worried? Back in 1975, scientists actually studied this in detail. They brought 125 healthy boys and men into a sleep lab, ranging from as young as 3 years old to 79 years old. These participants were monitored while they slept using equipment that tracked brain waves, eye movements, and even changes in penile size throughout the night. Each participant stayed for 3 nights, and the researchers used the second night's data to ensure accuracy. Importantly, they only included individuals with no sleep issues, no erectile dysfunction, and no medications that might affect their results. The goal was to find out what normal looked like across a wide age range. And what they found was pretty fascinating. Even kids as young as 3 were already having erections during sleep. These erections became more frequent and lasted longer during puberty, which researchers found to be the peak period for nighttime erections. For teens, a single erection during REM sleep lasted about 40 minutes on average, and that added up to around 40% of total sleep time. That's nearly half of their sleep. After puberty, though, things gradually shift. The frequency and duration of erections start to decrease slightly. On average, adults spend about 20% of their sleep time, roughly an hour and a half, with nocturnal erections. Each one typically lasts about 30 minutes, and most men will have between 3 to 5 erections per night. Now you might be thinking, maybe that's because we get less REM sleep as we age. But interestingly, that's not the case. REM sleep actually remains quite stable in adulthood. Most adults continue to get about 100 minutes of REM sleep per night. So the decrease in nocturnal erections isn't about sleep quality, it's more about subtle changes in vascular and hormonal function. A more recent study revisited this topic using advanced technology. In this study, 40 healthy, sexually active men between the ages of 20 and 60 were monitored overnight in a hospital. These men also had no sexual or sleep disorders and weren't taking any medications that could interfere with their erections. They were connected to a special device that measured their nocturnal erections throughout the night. And what did the study show? That erections occurred in every age group, even in men in their 60s. But the amount of blood flow during those erections declined with age. For example, men in their 20s had blood flow increases of about 268% during erections. By the time men reached 50, that number dropped to about 200%. That's still a healthy amount of blood flow, just not quite as strong as in younger years. What's interesting, though, is that the number of erections and their average duration stayed fairly consistent across all age groups. Men in the study had an average of 3.78 erections per night, and their longest erection lasted about 31 minutes. Other studies over the decades have confirmed these findings in various populations of healthy men. So what does this all mean for you? Well, in short, you should be waking up with morning erections and experiencing erections during sleep well into your later years. Sure, they may become a little less frequent or intense, but they don't disappear entirely unless something else is going on. In fact, the presence of nighttime erections is a really useful indicator of overall health. If you stop noticing morning erections, or you rarely experience them, that could be your body's way of signaling that something isn't right. And the reasons could vary. Healthy nocturnal erections rely on three main systems working together: your blood vessels, your hormones, and your nerves. If blood flow isn't reaching the penis properly, it could be due to cardiovascular issues. If hormone levels, especially testosterone, are off, that could also affect erectile function. And if the nervous system isn't responding correctly, that can be another sign. So when these erections start to fade or stop happening altogether, it's important to take that seriously. Many men begin noticing changes in their erections, like difficulty maintaining them during sex, around the same time they stop waking up with morning wood. Others might experience symptoms of low testosterone, such as low energy, reduced libido, mood changes, or weight gain. So what should you do if you're noticing a change? First, check your testosterone levels. A simple blood test can provide valuable insights. Often, one of the first signs of low testosterone is the loss of nocturnal erections. But don't stop there. Look at your entire lifestyle. What can you improve? Because ultimately, you want to be optimizing your overall blood flow, hormone balance, and nervous system function. That starts with maintaining a healthy weight. Excess fat, particularly around the midsection, can contribute to hormonal imbalance and vascular problems. You also want to be physically active. Regular exercise, especially resistance training with weights and aerobic activity like running, biking, or swimming, has been proven to boost testosterone and improve circulation. Ideally, you're doing both strength and cardio workouts each week. This combination not only helps erectile function but supports your overall health. And don't forget about sleep. Poor sleep quality, or not getting enough sleep, can directly affect both testosterone production and REM sleep cycles. That means fewer opportunities for nocturnal erections to occur. Managing stress is another key factor. Chronic stress raises cortisol, a hormone that can interfere with testosterone and increase the risk of erectile dysfunction. Find ways to relax, whether that's meditation, time outdoors, therapy, or hobbies you enjoy. All these lifestyle choices play a big role in your sexual health. When your body isn't functioning properly in one area, it often shows up first in your sexual performance. That's why morning erections are such a powerful early indicator. They're your body's way of giving you real-time feedback. If you stop getting them, take that as a sign to investigate, not to panic, but to take action. Many of these issues are reversible with the right changes. So here's the bottom line: morning erections aren't just a quirk of being male. They're a biological signal that your cardiovascular, hormonal, and neurological systems are working together properly. If they decline, don't ignore it. Pay attention. Reflect on what might be going on with your health and lifestyle, and consider making changes that support better overall functioning. Because the sooner you take action, the more likely you are to prevent more serious issues like erectile dysfunction from developing. Think of it this way: your body is giving you a natural dashboard light. You wouldn't ignore a blinking engine light in your car. So don't ignore this one either. Monitor it, respond to it, and use it as a chance to optimize your health, not just sexually, but in every aspect. Taking care of yourself isn't just about avoiding disease. It's about living a full, vibrant, energetic life with confidence. If you found this discussion helpful and want to learn more, I share Regu. Each edition includes sections focused on men's and women's urology, interesting new research, answers to subscriber questions, and insights into what's new in the world of sexual health. It's a great way to stay educated and engaged with your health journey. So if you're curious to learn more, sign up, because your health is worth it. Remember, taking care of yourself isn't selfish. It's necessary. And you deserve to feel your best every day.